All right. Good morning to the PT on Ice Day. I am your host today. My name is Dr. David Finkelstein, and I have the pleasure of serving as TA in the spine division. I am a TA in the cervical and lumbar spine management courses. The topic today is ask for directions. But before we jump into the topic for today, I wanted to highlight a few of the upcoming courses that we have in the spine management division. So on September 23rd, we actually have all three of our lead faculty leading courses that weekend. Zach is going to be in Henrico, Virginia at Onward Richmond. Jordan is going to be in Baton Rouge, Louisiana at Delta Physical Therapy. And Brian is going to be in Parker, Colorado at Onward Denver. So if you're looking to hop into a lumbar spine management courses, all three of those gentlemen are going to be running courses on September 23rd. If you're looking to jump into a cervical spine management course, Jordan's going to be in Brookfield, Wisconsin on July 22nd at Onward Milwaukee. Jordan will also be in Charlotte, North Carolina, August 26th at his home base of Onward Charlotte. And then Zach on September 9th is going to be in Roswell, Georgia at Onward Atlanta. So looking to jump into a cervical spine management course, those are going to be your next few opportunities in the coming months. All right, so let's jump in the topic today. The topic is called Ask for Directions. And the idea came from a conversation that I had with one of my coworkers. She was talking about one of her patients that seemed to plateau in their care, and she didn't know which direction to go in terms of directing her care. So when we're working with our patients, they're going to be giving us a lot of subjective information as the weeks go on. And my hope with today's podcast is to give you all some specific questions to ask your patients to know which direction that you want to go with their care, right? So I have 5 questions that I want you to consider, and they're more prompts so that way you can dive a little bit more into those questions as you ask them. All right, so question number 1, how did you feel after last time? I love starting with this question because it helps us know how the patient felt with our intervention after our last session, right? Usually our patients will say something along the lines of like, I felt good, right? Don't accept that as your answer and then type into your documentation system and then move on, right? We want to know how our intervention affected them. So you want to dive into that a little bit more. So when the patient says good, ask them, well, what does good mean? How good did you feel after last session? How long did that good feel for, right? So that way we know how effective our intervention was. And if they did feel good after last time, that might be something along the lines of you want to increase the vigor or continue on with the dosage of what you did last time to help prolong that uh, good sensation that they felt. Conversely, if they didn't feel good after last time, if they tell you, you know what, Dave, I actually didn't feel so hot after last time. I felt quite a bit worse. Don't panic. That's actually good news in a way because it helps you know that you were in the right place, but maybe your vigor was a little bit too much, or maybe your dosage was a little bit too much, right? Because if you weren't in the right place, their symptoms wouldn't have changed. Or conversely, they might have done something between the last session and your current session that also could have flared up their symptoms. You unpacking it a bit more. Maybe John said, I felt pretty good after last time, but then I mowed the lawn and then picked up a few boxes and then I did XYZ. And then after that, I felt a little bit worse. So it helps you know exactly if it was your intervention or if it was something that they did afterwards, right? It also helps you know if you establish their irritability correctly after the initial evaluation. So if you did your particular intervention, you thought they were low irritability and you intervene in an area and nothing really changed, you might want to consider going a little bit more vigorous into your examination or into your vigor to see if you can really elicit their symptoms. And then conversely, if they felt uh, like really flared up after last time, maybe your vigor was a little bit too much and you overestimated their irritability, right? So in both ways, that's a really good starting place when you ask the patient. So that first question is, how did you feel after last time? Question number two, how did you progress towards X goal? In our cervical and lumbar spine management courses, we talk about obtaining a subjective asterisk. Basically, that's something that the patient, that's important to the patient that you want to measure, but you can't measure in the clinic. So what that looks like is how many times someone woke up in the night because of their pain, or how long into their commute they're able to sit for before they have an onset of symptoms, right? So if you ask them, John, how did you feel after, or how are you progressing with your commute? And John tells you, you know what, Dave, actually, it's a little bit better because I was sitting for 30 minutes and then my symptoms came on, and now I'm sitting for 45. So now you know that your intervention was effective because their commute increased, right? Whereas, conversely, if they say, you know what, Dave, after last time, uh, I was, in my commute and I was only able to tolerate 15 minutes of sitting before my symptoms really started to act up a bit. Then once again, maybe it was that vigor, or maybe it was that particular intervention that you did that was a little bit too much, that might have increased their symptoms a bit. So asking them how they felt with that specific goal, with their subjective asterisks that you obtained in the initial evaluation, seeing how they progressed with that. And it also keeps those goals that are salient to the patient in the back of your mind that you continue to ask them in those follow-up sessions, right? So that's question number two, how are you progressing with X goal? Question number three, how often are you able to keep up with your exercises? I love asking this for a home exercise question as opposed to, are you doing your home exercises? Because it's a little less judgmental, right? If the patient didn't get to do their exercises, you're asking them from a place of curiosity as opposed to, did you do your exercises? So when you ask the patient how often are they doing their exercises, it gives the patient an opportunity to even tell you, you know what, Dave, I actually didn't. I wasn't able to keep up with those exercises. Uh, don't judge them for not doing their exercises, but look at that as an opportunity to uh, examine barriers to their adherence to their home exercise program, right? So you can tell John, like, John, what was up? How come you weren't able to do those banded external rotations? And they tell you, you know what, Dave, I just didn't have an opportunity to go out and buy the bands because I'm a little short on time, and it did help after last time, but I wasn't able to go out and buy the band. So that way, you now have the idea that the barrier was purchasing the bands, right? So then you can change that exercise to a sideline external rotation with holding a can of tomato sauce. There, you're kind of taking out that barrier of buying a band. You got the stimulus that you wanted, and then you also taught John a way of creating a weight in his house using a can of tomato sauce, right? So using that as an opportunity to identify a barrier. And then also, if your intervention was effective as far as a home exercise program, so take, for example, a patient with low back pain radiating down their leg. They say, Dave, doing those prone press ups that you gave me, I felt pretty good for about an hour after you gave me that exercise. But then it kind of went back to baseline afterwards. And then you realize that you dose that out at 3 times a day. You might even consider asking John, hey, John, you felt pretty good for about an hour after you did those exercises. What are your thoughts on maybe increasing that from 3 times a day to 6 times a day? It might sound kind of aggressive, but in that way, you're increasing that dosage of that thing that was helping John. So now you're getting a good idea of how your home exercises are affecting your patient, and then playing around with that dosage or that particular intervention, right? So that question once again is, how often are you keeping up with those exercises? Question number 4, how are you feeling today? Seems like a very basic question that we ask all of our patients, but I want you to think about why we're asking our patients that, right? We're asking that question to establish a baseline of how they feel right now. So that way, if we do some sort of intervention, that we know how it's changing their baseline symptoms, right? This is another opportunity that the patient might say, good. Don't take that good as your answer. Tell them, like, can you unpack that for me a little bit? Like, tell me what good means, and then start to trace out their symptoms, right? See exactly where their symptoms are, how intense are their symptoms. So that way, when you establish that baseline, you feel really confident about the intervention that you did, whether or not it changed their symptoms for the better or it didn't, right? Establishing that baseline. All right. So, question number 4, how are you feeling today? Question number 5, I think, is one of the most important questions that we can ask our patients, but is often overlooked. So, question number 5 is there anything you want to cover today, like talk about, do, that's really important to you? In that question, we're taking our hands off the steering wheel and allowing our patients to be in the driver's seat. We want our patients to feel a sense of self-efficacy in their care, and this is the best question to open that opportunity to know what's really important to them, right? Maybe our patients will say, you know what, Dave, whatever you want to do today, I'm game for, which is fine. And then you continue on with that plan that you had. But your patients might surprise you and say something along the lines of, Dave, I was actually thinking about it the other day that I don't really know how to get off the ground if I were to fall. And that's kind of been in the back of my mind for a while. In that, the patient's opening up to you, being vulnerable and saying, hey, this thing is really important to me. What you don't want to do is ignore that and be like, well, sorry, John, I had this other plan and I just wanted to proceed with it. Well, we'll cover that in the next session. You want to cover the thing that's most important to your patient because it's going to help take that kind of fear or that concern out of the back of their mind. And then in addition to that, you're helping boost that therapeutic alliance by addressing that thing that's really important to them, right? Nothing is going to tell your patient more that you're listening to them, that you're concerned about them, than intervening in that thing that's really important to them that day, right? So that question is there anything that you want to talk about or do today that's really important to cover in our session today? So those are the 5 questions. I'm going to give you a quick recap. Question number 1 is, how did you feel after last time, to know how your intervention affected their particular symptoms. Question number 2 is, how are you progressing with X goal? Recapping back to their subjective asterisks, making sure that you know exactly what's important to them and how that's progressing or not. Question number 3 is, how often are you keeping up with those exercises? So that way you can identify barriers to their adherence to their exercise program, in addition to knowing how effective your home exercise program actually is. Question number 4 is, how are you feeling today? Knowing in the back of your mind that you want to establish a baseline so that way you know how your intervention is affecting the patient. And then question number 5, once again, really important to ask our patient, is there anything important that you want to cover, talk about, do today that would be beneficial, right? So give those questions a thought, try that out, keep in the back of your mind why you're asking these questions, and then diving in a little bit more. Let me know how it goes. Shoot me a message in the comment section. I love talking about this stuff. I love the conversational piece and the therapeutic alliance piece of patient care. If you're looking for more opportunities to jump to some courses or see some of our free resources, go to ptionice.com. Check us out. Everyone, thanks for giving me some of your time and have a wonderful morning.